afternoon, everybody, and welcome to today's Diversity and Inclusion Dialogue session on health and well-being of Filipin-x American nurses during COVID-19, implications for implementing support. This event is presented in partnership between the UC Davis Office for Health Equity, Diversity, and Inclusion, the Campus Community Book Project, the UC Davis Health Asian Pacific American System-Wide Alliance, and the Bulasan Center for Filipino Studies. My name is Megan Macklin, and I serve as a program manager in the Office of Campus Community Relations, where I manage the book project. Thanks so much for joining us today. To begin, a couple of virtual housekeeping items for our event today. Today's event features live captioning from Otter Live Notes. To access the transcript, click on the red live icon on the top left of your Zoom screen. Today's event is being recorded, and the recording will be made available on the book project website. We encourage you to turn on your video. It's great, especially for our panelists, to see faces. And finally, throughout the event, you are invited to ask questions or share comments in the chat. The Diversity and Inclusion Dialogue series, sponsored by the UC Davis Office for Health Equity, Diversity, and Inclusion, is a monthly series open to faculty, students, staff, and community members to learn about and discuss critical issues to cultural humility, health equity, and diversity and inclusion. The series strives towards building relationships through increased understanding and trust, which helps to foster an inclusive workplace. For more information and for other resources, please refer to the D&I Dialogue series website. The UC Davis Campus Community Book Project promotes dialogue and builds community by encouraging diverse members of the campus and surrounding communities to read the same book and attend related events. The book project, a signature initiative out of the Office of Campus Community Relations since 2002, advances the mission to improve both the campus climate and community relations, to foster diversity, and to promote equity and inclusiveness. Currently in its 19th year, the book project in 2020-2021 focuses on the theme of mental health and features graphic memoir Marbles, Mania, Depression, Michelangelo, and Me by Ellen Forney. Our theme and selection have been supported by a year-long program of events, and today marks our last event of the academic year. To stay connected with the book project, please visit our website where you can find event recordings and other resources and announcements. On the book project website, you also can find information on our May 2021 series in recognition of Asian American and Pacific Islander Heritage Month. This series, in partnership with the Office for Health Equity, Diversity, and Inclusion and the UC Davis Health Asian Pacific American System-Wide Alliance, has focused on resilience, mental health, and well-being for the AAPI community. Finally, we welcome your involvement, student, staff, faculty, and community members, in selecting the book project featured title and in planning our annual program. If you are interested in getting involved with the book project, please send us an email or refer to the book project website for more information. And now it is my pleasure to introduce our moderator for today's session on health and well-being of Filipin-x American nurses during COVID-19, implications for implementing support. Dale Maglalang is a postdoctoral researcher at the Stanford University School of Medicine. Dale's research examines the social, cultural, and structural factors that influence health behaviors, with a particular focus on substance use and health outcomes among Black, Indigenous, and people of color, BIPOC, immigrant, and care worker populations. Dale is interested in integrating the use of anti-racist frameworks, community-based participatory research, and mobile health technology in social work curriculum and health interventions. Dale earned his BA in Asian American Studies and BS in Human Development at UC Davis, MA in Asian American Studies at San Francisco State University, and MSW and PhD in Social Work at Boston College. Dale is a faculty affiliate of the Bulasan Center for Filipino Studies at UC Davis and a core member of the Asian American Research Center on Health at UCSF. Dale, thank you for leading today's session, and please take it away.
Great, thank you so much, Megan, for the introduction. I will quickly share my screen so we can get started. So again, thank you again to the Office of Diversity and Inclusion in the UC Davis Health System, especially Megan and Coban, for inviting us to present and have this critical discussion today. So before we get started, I'd like to start with a land acknowledgement. We are gathered on the unceded land of Indigenous peoples. I ask you to join me in acknowledging Indigenous people, their elders, both past and present, as well as future generations. This acknowledgement demonstrates a commitment to beginning the process of working to dismantle the ongoing legacies of settler colonialism. As we know, decolonization is a verb. So beyond this land acknowledgement, I encourage folks to also consider donating and supporting the works of Native American organizations in the country. One organization I would recommend is the Indigenous Peoples Day MA.org. They're an organization in Massachusetts that mainly works during the day of mourning, which is usually Thanksgiving, and they usually hold an event in Plymouth, Massachusetts by Plymouth Rock, and they invite Indigenous folks from all over the world, and it's the day of recognition, celebration, and also supporting how we can support Native Americans moving forward. So if there are also other suggestions for Native American organizations that folks could direct people to, please put them in the chat. So I think just to give you a quick agenda of today, I'll quickly provide a background of Filipino nurses and their experiences, and then we'll shift over to our wonderful panelists who'll introduce themselves, and we'll get started with the discussion. And we'll leave the last 10 to 15 minutes of today for Q&A. So if you have any comments or questions for our panelists as they're sharing their experiences, please put them in the chat and we'll get to you at the end of this discussion. So just to give a quick overview of Filipin-x American nurses, there was a report that was released by the National Nurses United in September of 2020, and they found that 1,718 healthcare workers died due to COVID-19 related complications. 213 of this number are registered nurses, and they're over half are nurses of color. And a very glaring data that they found is that 31.5% of nurses who passed due to COVID-19 related complications are of Filipino descent, despite the fact that Filipinos only make up 4% of the nursing workforce in the country. So, in order for us to understand why there are a lot of Filipino nurses in the country, we have to understand the relationship of the US and the Philippines, right? So if folks don't know, the Philippines was a US colony from 1902 until 1946, after the Philippines lost the Philippine-American War. As part of the Philippines becoming a colony of the US, they established the first nursing school in the Philippines in 1907 at the Philippine Normal School. So as a result, we've seen this migration of Filipinos coming to the US to work in different sectors, in agriculture and canneries in Alaska and Seattle. But we also see that there was this influx of nurses that was further encouraged by immigration policies, right? So we had the US Exchange Visitors Program in the 50s, and of course the 1965 Immigration Act, which created the stipulations of skilled and unskilled workers to enter the country. So as a result, we see this large number of Filipinos that started entering the country through labor and also family reunification. So by post-1965, they actually found that the Philippines, which is true up to this day, has been one of the leading exporters of nurses to the US. In 2013, they found that 33% of foreign recruited nurses in the US are from the Philippines. And it was actually over 40% before the 2008 recession, so it was higher then. And we know that with an aging population, right, that we're expecting that the current shortage of healthcare workers in the country, there is this expectation that the US and other Western countries will continue to recruit Filipinos from the Philippines to work as nurses in the US. So, we've known this history of how Filipin-x nurses have been recruited in terms of meeting the demands of different public health crises in the US. Dr. Catherine Saniza Choi at UC Berkeley wrote this wonderful book, Empire of Care. And one of the things she talks about is during the AIDS epidemic, the US heavily recruited Filipinos to work in units that are serving patients living with AIDS. More recently, Jennifer Nazareno at Brown University published a study where they found that Philippine-trained nurses are more likely to work in 24/7 inpatient units with patients with higher acuity illnesses, more rotating shifts, and on-call hours compared to white US-trained nurses. And earlier this year as well, the Philippine government was willing to offer Filipino nurses to work in Great Britain and Germany in exchange for COVID vaccines. So we've seen kind of this, how Filipino nurses have been in this vulnerable state in terms of how they're being used as a way for for both the Philippine government to earn certain vaccines, but as well, right, the Philippine government is also benefiting a lot through the remittances of overseas Filipino workers, which include nurses. So, so I hope that this gives folks kind of an overview. Why are there a lot of Filipino nurses in the country? And also why it might explain this disproportionate number of Filipin-x nurses who passed away due to COVID-19 related complications. So I'd like to introduce our panelists. I'm going to ask them if they could all just introduce themselves. So we'll go in order. If we could please have Iris C. Merelos introduce yourself.
Yes. Hello. Good day, everyone. My name is Iris Merelos. I am a critical care nurse in UC Davis, working in Tower 7 MSICU Blue, that was initially assigned as a COVID unit, one of the COVID units in UC Davis. Apart from being an ICU nurse, I'm also a mother of a 14-month-old baby, and also a caregiver of my mom and dad, who's 82 years old. Mom is 75, who survived brain aneurysm with 3 brain surgeries. So I'm technically a nurse 24/7.
Thank you, Iris. And Gabriel C. Ortigoza, are you here with us?
Yes, Dale, I'm here.
Awesome. Thank you, Gabe.
So my name is Gabriel Ortigoza. I am a graduate of Central Philippine University, class 1991, which is otherwise known as the first nursing school in the Philippines, founded in 1906 by the American missionary. So it was used to be a name, Iloilo Mission Hospital. So again, that is the first nursing school in the Philippines, founded in 1906. And I worked at Kaiser Permanente, South Sacramento for 16 years. And I said when I reach 50 years old, I will stop working at the bedside, which I did last November 2020. Now I'm back here in California. I spent like 5 months in the Philippines to start farming. I'm growing organic vegetable farming in the Philippines, aside from rubber plantation. So I'm back here for academic summer quarter at UC Davis School of Nursing for quarter school year until September 10, 2021. Thank you.
Thank you, Gabriel. And Jane Sandoval.
Hi, good afternoon, everyone. My name's Jane Sandoval, and I'm a registered nurse. I've been a registered nurse for 36 years. I currently work at the emergency department at California Pacific Medical Center, Mission Bernal Campus, formerly known as St. Luke's Hospital in San Francisco, and I work in the emergency. I am also a member of California Nurses Association. I am on the board of directors of California Nurses, and I'm a vice president of NNU. Thanks for having me.
Thank you, Jane. And Dr. Claire Valderama-Wallace.
Hi, good afternoon, everyone. Claire, my pronouns are she, her, hers. I've been a nurse now for 13 years. I'm actually an alum of the Bedarian Moore School of Nursing. I graduated there. Ooh, that feels like a long time ago, but it was just in 2018. I am an assistant professor at Cal State East Bay. I teach community health nursing. I'm also the coordinator of the MSM program, and I'm the chairperson of Gabriela Oakland, a grassroots Filipino women's org. Thanks for having me.
Great, thank you so much. Sorry, I want to apologize in advance. My dog is barking. So I'll stop sharing my screen and I think we can have a conversation, right? So, the first question I want to ask the panelists is, what has been your experience as a Filipino American nurse during the COVID-19 pandemic? You can talk about both in your unit, the larger hospital setting, or even among your family and friends.
Okay, I'll start. Since I worked in a COVID critical care unit, so I acutely felt the effects of coronavirus pandemic, both on my personal and professional level. I was actually 38 weeks pregnant when the first case was made known to us. It was COVID-19 first case via a community transmission. And when Governor Newsom announced the stay-at-home order, I was in my early stages of labor at home. So my husband and my family members purposely turning off TV, especially when it's a news channel, so I would not be freaking out, because I was already freaking out. Because I was like, oh my gosh, I'm gonna give birth in the middle of health crisis while everyone was ordered to stay at home, and I'm gonna leave the house and actually go to the hospital where sick people would go. So I was really freaking out. There was an overwhelming fear and anxiety of what was gonna happen to me. A lot of people were telling me that my maternity leave was happened in a right time because it was a pandemic, but I didn't really feel that, because even though I gave birth, I went home safely, nobody was sick. At home, I felt the pressure that, oh my gosh, my colleagues are in there, like in the battlegrounds, in the battlefield, and here I am at home. It's not that, although I'm enjoying my motherhood, I'm taking care of a cute baby, staying at home with my husband, but at the same time, I felt like I should be there, right? So anyway, when I was on maternity leave, I was still receiving emails at home from work, and a lot of nurses were sharing informations about COVID, their experiences about their first patient, the deaths, how they cope up, what are we going to do, even though those information that were confusing from CDC and World Health Organization. So I was reading those. I was trying to, at first, while everyone on vacation or maternity leave or some sort of leave would go away from work emails, I was reading work emails because I want to keep myself in the loop. So that's what happened. So I was knowing everything, even though I was on maternity leave. So fast forward, I went back to work at the second wave. It's actually the peak of COVID. And I already mentally prepared, physically prepared, spiritually prepared myself. However, when you're already there, it was still like a shock, like death the first day, second death, next day. And it was exhausting. It was taking an emotional toll on me, not only for me, but for everyone. We depend on each other. It's like from seeing your patients, you don't see them anymore or they don't see you anymore because you wear masks. Sometimes they can't hear you. And when I remembered vividly my first patient that died, and I was just like 5 days on my first, when I went back to work, I don't know how to feel. Like I was holding his hand with a family in Zoom, and I wasn't used to it. Pre-COVID, we see family members at bedside able to communicate, able to say goodbye, and able to, just show love. But this time, I became the family. I was the one holding their hands. I was trying to be the family at the same time the caregiver, and it wasn't an easy job for me. Every time I go home, I tried to remove that hat, because at home you don't want your family to see that part where you're sad, where you're frustrated, where you're depressed. When you go home, you have to be a family member, you have to be a mom. And at first I wasn't prepared for that, but with all the support of family members, colleagues, friends, I was able to go on and go back to work again with not having a heavy heart. So it wasn't easy, but we were able to cope up.
Yeah, thank you, Iris. It sounds like you were wearing multiple hats, both as a caregiver and even at the same time, like protecting your own family from having to deal with the stress that you were experiencing at work.
Yeah.
I'm wondering, Jane and Gabriel, if that was, also something similar that you experienced, or I know especially Jane, you work with the California Nurses Association, if that was something that echoed among all the members of CNA.
Yeah, I would have to say yes. And first of all, thank you, Dale, for the historical perspective, because that's really important that people understand where we come from. And for those of us that are guests and listening, if you're numbers people, just the fact that during the pandemic, well, we're still in the pandemic, 54% of the nurses have died were people of color. And even Filipinos make up 4% of registered nurses in the United States, but half of the nurses of color have died have been Filipino. It's so alarming, and it's so alarming. Yeah, just well, first of all, congratulations, Iris, on her baby. But my kids are adults, but still, day to day, you go to work and you wonder, is this the day that I'm going to get sick? And I'm not gloom and doom, I'm not paranoid, but of the fight for PPE, personal protective equipment, was ongoing from the get-go. There were empty accusations, rumors from admin down saying that the reason they were hoarding the PPE from us was because nurses were taking them and sending them home. Of course, they didn't say it was the Filipinos or the Asians, but sending them home. I mean, what else? Who else? It means mostly Filipinos in the hospital anyway, working the front line. So was a lot of disrespect in that respect. We should not have had to fight for our PPE. I am an emergency room nurse. I work on the front line. There was also, besides the fight for the personal protective equipment, just to protect ourselves, there was also, are we COVID testing our staff? Are we not COVID testing our staff? And the bottom line was they were not COVID testing the staff. And as the CDC rolled out their very confusing recommendations, it was the way that they protected this, that we were protected in the hospitals, was even more lax. So luckily, with our own fighting for ourselves and fighting for each other, which also fights for the community, we were able to fight back with a lot of these things and say, no, we are not going to sign out our masks or reuse masks like they wanted us to. Some nurses had no choice because that was what their bosses and managers had them do. But I was fortunate enough that I just stood my ground. I said, I don't have to sign out our N95 mask. They wanted us to do things like put a reason why you need it. Well, what the hell do you think my reason is for wanting an N95 mask? Because I look cute? It was to protect myself. And when I protect myself, I protect my family, and I also protect the community. So it's pretty, everything trickles. So there was a lot going on. There's kind of a lot to say about the experience. It's pretty big. It's really big and ongoing too, as well, I might say. The fight's not over.
Thank you, Jane. And then Gabriel, I'm wondering if you had similar or different experiences from what Iris and Jane shared.
Yes, I have almost a similar experience with them. I was assigned in a COVID floor at Kaiser South Sacramento, and we're the first to get this COVID patient. And I remember July 2020, my first patient was my good friend. She's a nurse at UC Davis, but she was admitted at Kaiser South Sacramento. When I entered the room, she first identified me and she called my name. Gabe, thank you. You are my nurse today. So I realized that she's a nurse. In fact, she's a medical doctor in the Philippines, who is a registered nurse here in the US. And I said, COVID-19 doesn't choose whether you're a doctor, you're a nurse, or anybody. So you can be infected anytime. If it's your time, then that's your time. So what made me prepare was my background at school. We were exposed to infectious disease. We were exposed to a TB tuberculosis ward with like 50 patients in one ward, one nurse in there. Me as a student nurse working with a staff nurse. So from the beginning, from the get-go, we were already prepared to be exposed to those infectious disease. So moving forward here at South Sacramento, we were exposed during this COVID pandemic, and we have several nurses who were exposed to the virus and got infected. By the way, 60% of registered nurses at Kaiser South Sacramento is Filipino. So majority of the nurses in Kaiser in South Sacramento is Filipino. And based on the national statistics, there are only like 4% or a few percent of nurses in the US is Filipino, but here in South California, California is where the 50% of Filipino is living. There are like around 4 million Filipinos in the US, 2 million is living in California. And again, the issue with COVID-19 at the bedside is number one, the PPE. We ran out of PPE. We used to autoclave, reuse our mask, and then we just put name in there. After it has been autoclave, it was returned back to us. And then later on, we're not doing that anymore. We are using our mask for the whole day, and then we change it. And that is the main problem. Until now, PPE is still the main problem. And we used to don and doff off our PPE after leaving the patient's room. And then later on, we use one PPE for the whole 8 hours duty. So if we have 4 patients, 3 patients that day, we're using only one PPE. And then we just remove it after end of the shift. And still, Filipino nurses, when they are on the floor and they need help, it is hard for the supervisor, for the manager to provide campus support. But if it is Caucasian who are assigned to the floor, it is easier for the management to get campus support to help us. So that is the observation I made during this pandemic, and it is still ongoing. So there are several experiences we have, but those are the main point that I want to share with the group today.
Yeah, thank you, Gabriel. And I think it was interesting, kind of, you brought up this idea of like power dynamics that is related to race and how it plays out in the workplace, right? And also, bringing up the statistics, I think Jennifer Nazareno's paper, she wrote that 1 in 20 nurses in the country are actually Filipino. So it's really, an interesting statistics. And Claire, I'd love to hear, as a professor in nursing, was this like something, what our panelists have been sharing, was this something that you're hearing from the students as well?
I can speak to the multiple hats as well. So appropriately, we lost a number of clinical placements, right? They said don't send students, and eventually you can send students, but instead of a group of 10, only send 4. And so essentially, for protection and to honor our relationships with our clinical partners, most of our students are graduating late, and you'll hear that across nursing programs. So we'll feel those ripple effects for many years. And so, losing clinical placements, it also gave us an opportunity to say public health matters. Oftentimes, community health nursing is just not seen as valuable when it comes to the powers that be that regulate nursing education. Oftentimes, people see public health or community health nursing as outreach, but we see decades of divestment from public health. I mean, the lessons learned are right in front of us. So for me, it was really this lesson of, we keep talking to nursing students about you're entering a profession. This is a profession. But what does that mean also when in the healthcare industry, workers are not protected. Workers are actively exploited in a way that doesn't just victimize, but also lets us know we have to really come together. And so it gives us an opportunity to talk about white supremacy in action, what it means for the healthcare to not be a right and for us to not automatically care for each other, but for it to be a commodity, right? And so it gives us an opportunity to talk about politics. It gives us an opportunity to connect our struggles as Filipin-x nurses and students with the experiences of other historically excluded communities, right? But I have to say the tension of profession versus worker is really an interesting conversation we've had to have. A lot of stress. I mean, when we talk about nurses, we're also talking about nurses whose children or nieces and nephews or grandchildren are in my nursing program or as students. And so they also have cousins and titas and uncles and parents all around the world because of that labor export policy. So, how do we care for students entering this profession and this industry that's not necessarily caring for them and actively putting them in harm's way, while also saying, how are you doing? Your mom works at a nursing home. Your cousin is a CNA. Your uncle lives with you and has COVID right now. So how do we care for each other in a nursing education community? And so there's a lot. And I would say finally, for my last hat, as a community organizer with Gabe Oakland, I called our folks, my connections at CNA and said, how can we support? So we rolled out our communities, including nursing students, to hospitals to say, we demand more, we stand in solidarity. And so those are some things I'll highlight.
Thank you, Claire. And it sounds like, there was kind of, it's true that in a sense, there seems like there's this comprehensive need, right, for support that I think a lot of our panelists have brought up. And I think maybe we can segue right now into this idea of support, So I know some of y'all have like talked about that, but more explicitly, what type of support did you receive, either from your work or your family that you found helpful, right? Whether it's through your unit nurse, manager, or your supervisor, or maybe even if the hospital or your workplace did something that was more at large that you found helpful, or if not, what type of support did you wish you got, right? As a nurse that's working during the COVID-19 pandemic. Oh, I think Iris, you're muted.
Okay, I'm so sorry. So this global pandemic causes unprecedented stress, especially for us health workers. I am fortunate enough hearing some of the sharings of other panelists. I am fortunate. I'm glad to share that as an employee of UC Davis, I was fortunate enough that I did not experience the one that I have to reuse PPE. We were provided by our management actually choices on which one to use. So there's a point where I have to use the 3 because I want to make sure that I have an option to wear an elastomeric. I have an option to wear the respirator. I have an option to wear just the N95. So I never experienced that I have to reuse it. And I've never experienced that I have to wear it for straight 12 hours. There were a few times that I've worn at least twice when we were still trying to save, expenses, and we don't have enough N95. So I didn't have experience that, but I want to share that I have a cousin who works in a nursing home in Buffalo, New York, that had to pay and buy her own PPE, face shield, and even isolation gowns. And I was so sad that they did not get that support that I have. My sister, who is a home health nurse here in Sacramento, was looking for PPE in Amazon because they didn't have one. And I'm so sad too, because she goes to a household where she doesn't really know if they have COVID, and she didn't have PPE. And I was wishing them and hoping that their hospital or their management, their employers would actually give that support that I have, because we're all working with them and not for them. So I wish that they have that support too. So that's what I had in my unit. I didn't feel like I wasn't supported in terms of like keeping our sanity, because it's making us crazy too. Like of our mental health, we have to take care of our mental health and physical health. So our unit and leadership was actually very creative to celebrate every month cultural heritage. So May, we had Cinco de Mayo, we have Mardi Gras, we have the February. Filipinos were assigned, I believe, this coming summer for something that's everyone can enjoy. So while working, we are actually enjoying as well. And that actually is already a good support. We have our management, our leadership that's actually giving prizes during our festive month for self-care. We have like how do you call this one? Gift cards for massage, which I don't know if they're going to go to a massage, but that's self-care. And we need that because we need to be 100% whole so you can actually give more to your patients. I believe if employers will support safety, provide PPE, a lot of nurses will be able to work more, giving their whole and promoting safety for their patients and their family as well.
Great, thank you, Iris. So it sounds like your workplace at UC Davis really provided a comprehensive type of support. I'd like to get a gift card for a massage as well. So
Yes,
if you want to send it over, send it over.
That's right.
But I know Jane, you spoke about earlier about having to advocate for yourself, that you said that you need more PPE. So how about Jane and Gabriel? Like, were there other types of support that worked out for you in the workplace?
Right.
Or
Well, first of all, number one is having the union back us up collectively. Our union protection has been especially important for healthcare workers during the pandemic and even currently. Now more than ever, our collective voice as union nurses is about saving lives. From the onset, we were fighting to get the employers accountable to get PPE. I'm glad that Iris had this great experience of both her employers and taking care of each other. Honestly, our manager and our employer, zero. They did nothing for us except restrict us, tell us things that we can't do, very punitive. Luckily, for our own sanity, we just had to learn to step back and take care of ourselves. But there was minimal support. If anything, there was chastising for errors as if we were small children. So more than anything, we really needed the union support. We're fighting for PPE. We, at some point right after, I want to say second wave, but it really wasn't a second wave because it really didn't go away when our hospital, almost all the hospitals put applications to waive the nurse to patient ratios. It's a very big deal because the way we provide safe care for our patients is safe nurse to patient ratios, which is something that California nurses have put into law in California for more than a decade now. We fought that. Our ratios were in jeopardy. I was on a meeting with some of the administrators, and the words from the administrator's mouth was, we said, why did you apply to have these ratios waived during a pandemic when you need nurses the most? And his managerial answer was to be proactive. And I said, that's not being proactive. That's going backwards. That does not protect us. After a big fight, we did manage to save that. And another big win that we got is legislation that just passed recently in April, is that employers must provide a 90-day supply of PPE for nurses. And nurses don't even know that today. It kind of just happened, but not just happened. But so some of them are still reusing their masks. They're unaware that they don't have to save it in a bag like we all have did. They sound like horror stories, but it really was happening, that people were saving their N95 respirator masks in a bag. I was not at the point that I had to purchase my own, but yes, we were scared to death, and I did buy my own heavy duty mask just in case I needed it. I had it in my locker just in case. There were a couple of scary moments. It's like we were running low on cover gowns, but the supervisors did bring it up. But the fact of the matter that we had to have them call and bring them up was, ludicrous. When we need it, we need it. And they're still being rationed, or they're just not making it really known that the supplies are adequate. But we did everything we had was for a fight. We did not get the support from above management, as we know, the big picture of big corporations and not caring for the caring profession because just the silencing of the invisible caretakers. But I will say this, organizing, speaking up, and taking care of each other, and just an awareness of everything that's going on to protect yourself, and collectively band together and speak up and take care of each other is so important.
Great. Thank you, Jane, for highlighting the need to organize, right? I mean, it seems like you don't need to be a nurse, right, in order to be an ally or support the work of like California Nurses Association, right?
Right. As long as everyone knows that all it takes is solidarity, and it doesn't. And even if you're not a nurse, if you support those people that are working for advocacy as well, and community.
Great. Thank you.
Because we're all intricately connected to each other.
Yes. Yeah. So yeah, I'm wondering, if Gabe, if you want to add on to that, but also Claire, right, as an educator, it sounds like, I'm sure you have to provide different types of support for your students, right? So I'm wondering if either Claire or Gabe want to speak on what type of support worked well.
So let me go ahead, Claire. Is that okay, Claire? Okay, thank you. So I have the same experience like with Jane, that during the pandemic, um, there's understaffing, and our manager used to go and talk to the patient every day, ask them how's the service, what can we do. But during the pandemic, they're gone. You cannot see them. I think they're afraid to expose themselves to the patient because of this infection. And the one you see at the bedside are those nurses assigned to the patient. And there were understaffing. And I observed that management doesn't want to add more people for the COVID unit. And those are the main major problems we have. And also, we promote social distancing with each other, but during a huddle time, there were like 20 more or less nursing service people in one break room with like 1 inch, 2 inches length distance between us. So there is a violation of the social distancing that was promoted in the healthcare units by the CDC, by the hospital, and it happened in the hospital itself. So there is no social distancing. That's why a lot of nurses in my floor were infected, and they were sick, and some of them were confined at hospital. Some of them stayed home. That's because we don't know who infected whom. Is it the patient or us as nurses? There are about more or less 50% of infected COVID patients are asymptomatic. So we don't know who is infected among us. So that is one observation I observe. And again, it's hard to get those supplies. That time we're fighting for, again, ratio. They want to uh, erase the nurse-patient ratio. By the way, California is the only state with a nurse-patient ratio in the U.S. So we want to stick to that and want to make sure that the law is implemented. And thanks for the union, because they're there, they're watching, they're helping us, and we're happy. We have this union, and also we have this Filipino Nurses as association in our group.
Thank you, Gabe. And Claire, I don't know if you want to add on to any of that.
Sure. So a couple of things. One is there's a lot of hopelessness, kind of in the face of everything. You know, we talk a lot in my courses about systems level issues, right, and how they trickle down, and we experience them in different ways at individual, family, community. And so, you know, we had a series of workshops. We partnered with CNA, and that was a great way for students to get, you know, a more formal introduction to labor. In courses, I also got to talk to them about the role of student-led movements. You know, we can talk about DAPL, the Dakota Access Pipeline. We can talk about, you know, other youth-led movements. We can talk about why ethnic studies exist. So giving nursing students examples of how young people, young in age, but also young to their new careers, have really made important changes. Last thing I'll add is, last summer I opened up, I said, you know what, so many folks don't know our own history. I don't think only Filipinos should read Empire of Care. I think everyone, not even just in healthcare, everyone should read Dr. Choi's Empire of Care. So I just opened it up. I said, whoever wants to meet over the summer and talk about, you know, her book, or, you know, look at different videos or articles, let's do it. So there's a group of, thank you for sharing that. There's a group of Filipino students, not all of them are Filipino, but most. And we would talk about, what does it mean to be a Filipino nursing student? What are your experiences like having to navigate the stereotype? Having to navigate all of your parents and aunties and uncles and titas expectations that you have to become a nurse. What does that mean? What does that look like? But also at the very end, we would explore poetry. I'm not a poet. I'm not a writer at all, only scholarship. And that's a very particular type of writing. But I learned about Tanaga, this indigenous Tagalog poetry form. And so I invited students, and, you know, they wrote them in English and Tagalog. I'm just reflecting on what it's like to be a Filipino nursing student today. And you're not asked to write poetry and to reflect in that way in nursing education. And I think it's so vital. So all these ways of outlets of hope, of release, of reflection, of music. We start every class with music now. I think, you know, students play DJ. So all these different ways, from what seems like minor to big systems things, we're trying to do.
Yeah. Thank you, Claire. I appreciate kind of finding ways of creativity, right, to help one another. And I think you bring up a very good point about this stereotype that I think there is this expectation that Filipinos become nurses, right? And I think it really goes a lot with, the history of even the Philippine government capitalizing on this. In 1995, they started this whole campaign of like overseas Filipino workers or OFWs, calling them as bagong bayani, which means new heroes of the country. And that includes, of course, nurses that work overseas. And as a result, right, now we see that 10% of the country's, in 2018, 10% of the country's GDP, the Philippines, is coming from remittances alone of OFWs. So we see that the country is very much heavily dependent on the remittances that a lot of OFWs send. So I would like to shift towards, I think, our Q&A, because some of our questions relate to some of the questions folks sent out. So if you have any questions for our panelists, please put them in our chat box. I'd like to start with this one question we got. Any of the panelists can answer this. Would you still recommend nursing to your children as a career choice?
I would.
Yes, I would.
And Jane and
honorable profession.
The most
I would
trusted
recommend.
profession in the United States for 19 years now.
Yeah, year after year, the most honorable, most trusted profession, nurses.
Okay,
I would recommend, but I won't enforce, like the aunties and uncles telling us to, it's their dream, but they want to be nurses, but I don't want to do that to my children.
My own children did not become nurses, but I have a niece that decided on her own to become a nurse. So I'm like, yay.
My eldest son is now first year in San Diego State University nursing program.
Woohoo!
Right. And then Claire, I know you're an educator. Would you recommend it?
I think I would say, I would hope for my kids to want to be agents of change. So that could be as nurses, that could be as educators, there's so many, I say that now, but the the pool of upward mobility of, socioeconomics means something, but I don't know that I have like a full on, it's like yes with an asterisk. So yeah.
I wonder, are there aspects of nursing education that you think nursing school should be aware of in order to prepare nurses better during the COVID-19 pandemic?
You know what, it's interesting. I'm actually doing a research project now speaking to nursing students and new grads about their pre-licensure education. And so much of what I'm hearing is that it's an experience of different forms of harm. And mind you, most of the participants in my study are students of color. There's a lot we need to change. It's very much a colonial system. It's very much don't question, take it all in, regurgitate it, and you'll really learn the job once you're licensed. And that is not how nursing education should be. We should be caring for students. We should be empowering them to help change what's happening out there. So I am all about changing and transforming because it's a highly problematic system. Some good things, but a lot to change.
And Jane, Gabriel, or Iris, would you agree, or do you have any kind of recommendations that nursing schools should be aware of to better prepare nurses in terms of education, especially during the pandemic?
I guess more of like availability of information and education, probably included in a class, disaster preparedness. I think when I was a student, we knew about infectious disease, but it wasn't more focused on a pandemic. It was mentioned, we had like an introduction that there was a pandemic of Spanish flu before, but there was no like, okay, there was not like a very detailed part in our education in the Philippines. This is what I can only speak for myself. And I guess if nursing students would have that information, then it will be great it will be a good tool for them when they become a nurse.
I know that a lot has changed since I've been to school. I've been out of school for a long time now, but I grew up at a time where there was a whitewashing of history. That's why I had to reiterate what Dale said was really important. So now that we know what we know and we're still learning, I do like to kind of also reemphasize what Claire said about having your students or any one of you be agents of change and know that the normalization of oppression of workers, be it Filipinos at the bedside or in the community, this and the silencing and, you know, we're not invisible. It needs to end. So speaking up, realizing, looking at the big picture. It's, I realize now that I, you know, have been doing this for a while and now can look back, but giving students the tools to look at the big picture and see how we all are intricately connected to each other. Go in with eyes wide open.
Thank you, Jane. So the next follow-up question that we have from Coban is, are there other ways that the Filipin-x culture and community support your needs, particularly your mental health?
I think the unity and the solidarity and just even panels like this, I find so empowering. I think that's also part of it. Just as on the same note where I say that we can't be silent, but these forums provide so much empowerment and builds our strength and solidarity so that we can also share it with others.
How about Gabriel or Iris or Claire? What are other ways that we can help address mental health? Because, you know, there's also that, I think, issue in the Filipino community where we don't really talk about mental health, right? It's you're just supposed to suck it up. Mental health doesn't exist, and we oftentimes somaticize it, right? We say, oh, like, oh, my back hurts or my head hurts, but really we're not getting to the root cause of that. So are there ways that you think it would be helpful to address mental health, especially among Filipino nurses?
One of the characteristic of a Filipino is there's a shy in its personality. So they're shy to tell you they have a psychological problem, and they're shy to be referred to a psychiatric if there is a problem. So we want to educate them and let them know it's okay to be referred to a proper physician for help. Don't keep it yourself. Let us know and voice it out. That is therapeutic, and don't be shy. This is to help you and help your family. So I would like to encourage everyone, if you have some problem, let the physician know, or go to the psychiatric or psychologist for help. Ask for help, and there is help outside. Thank you.
Great, thank you. So, you know, another question that we have is, what is your stance and thoughts on COVID-19 vaccination here in the US and in the Philippines?
For vaccination, I came back last Saturday, May 22nd, and on May 23rd, Sunday, I got my COVID vaccine, and I chose the Johnson & Johnson's Janssen. It's only one dose, and it's gone. So I experienced fatigue 24 hours after, and now I feel better. And compared to the Philippines, the vaccination process is sometimes is kind of problematic because there's a vast influx of Sinovac from China. And now they want to give you a first dose of Sinovac, and then your second dose will be, it's either AstraZeneca or they're also Pfizer. So they're making another study on that. And one thing I've observed, that if you were vaccinated with Sinovac and you're going to the US, the immigration will not accept you. And also in Europe, they are not accepting people vaccinated with Sinovac. It's only a Pfizer, Moderna, Johnson & Johnson's, and I think AstraZeneca. And no Sinovac accepted in the Western world. That is my first observation. So people are now, in the Philippines, they're now looking for another brand aside from Sinovac, because they said they cannot travel abroad if they are vaccinated with Sinovac. So that is one thing that is happening in the Philippines right now. And I'm glad I got my vaccination in the US, Johnson & Johnson's Janssen product.
Great, thank you, Gabe, for that comprehensive overview of what's happening in the Philippines. I wonder if we have any other questions from the audience regarding what folks have been sharing, or if any of our panelists want to kind of like add on to anything that they've shared.
I'm going to share in continuation of about the vaccine. I want to share, like, in my household, my mother is an anti-vaxxer. So it had, being a caregiver, it was really hard and frustrating for me to have one family member not believing science. And, I have to question her at one point, like, why do you send me to school for nursing when if you don't believe your daughters who are nurses? And so it took me a while and a lot of convincing. I did not force her because it should be an informed consent. I educated her and also prayed that she will allow, and give her a chance to be vaccinated. And I'm glad she did. And I'm so happy and proud that all my family members are all vaccinated now. I am thankful for our government that our vaccines are accessible to all compared to our home country, which is very sad that it's still not available for all people. So I'm sad. I'm also fortunate that I feel happy of what our case here in the United States, but I feel sad for our fellow countrymen in the Philippines.
Great, thank you. And I think that's a reoccurring theme among, like, especially among people of color, right? There is this medical distrust, right? And we know that this is a history, right, of public health, like exploitation that have been done, particularly among people of color, right? So I think we're nearing our 2-minute mark. Maybe if folks can quickly answer this one last question we have. What would be helpful to convince some unvaccinated Filipinos in the US with getting the vaccines? Is it misinformation or cultural beliefs? I know, Iris, you shared about educating, but I don't know if Jane and Gabriel or Claire want to add on to what other strategies can folks do?
I think it's a little bit of both information and mistrust. However, what I like to point out is even though they're not 100% effective, it will still protect you from spreading it for another, and it will prevent you from dying. You hate to throw out the big, what if you die? But unless you're blunt, it's like, then they won't have the shock value. It's like, I'd rather not die. I'd rather not give it to a loved one. I'd rather not give it to my elderly neighbor that lives next door when I'm having a chat with them.
Great, awesome. So I think we're nearing our 1-minute mark. I just want to say thank you again to UC Davis Office of Diversity and Inclusion for inviting our wonderful panelists today, and of course our panelists for sharing a lot of your experiences and also strategies in moving the nursing workforce forward that really centers the needs and well-being of nurses, especially folks that are from marginalized communities like Filipino nurses. So I just want to say thank you. If we could give them a round of applause virtually. And I don't know if Koban or Megan want to say anything else. And thank you to all of our attendees for joining us today.
Thank you for having me.
Great.
Thank you too for inviting.
Yes, thank you all for being here. This was an incredibly powerful discussion. Dale, thank you for leading it, and all the panelists for being so open and sharing your experiences with us. Everyone in the audience, stay tuned to the Health Equity, Diversity and Inclusion Office, along with the PASA Campus Book Project for other similar events. And if you have feedback or would like more of these types of sessions, please do reach out to us. Thank you all again.
Thank you. Take care.
Thank you so much.
Thank you.
Thank you.